Welcome to a new episode of Smiles in the Air, your oral health and prevention podcast. I'm Salsa da Costa, and today with me I have Valentino Natoli. So, Valentino, welcome to the podcast.
Thank you so much, Chelsea. Thank you for the invitation.
No, thank you for you for flying from Italy, from the south of Italy, to meet us here in Switzerland. So, I invite you because we have really a funny story. So that's we just knew by pure luck. You sent me an email, and this email just blasted, and I'm sharing your story with everyone. But tell me a little bit who you are first, and then we're gonna get to it.
Perfect. Thank you. I am Valentino Natoli. I am a dentist. I am a GBT trainer from Italy, and I do a lot of scientific work. I am a researcher, and I'm a PhD candidate, and I love GBT. I do in 2021 a publication, a review with my colleague from India, from Saudi Arabia, about GBT. The first review about the GBT, and we compared in this paper GBT with the whole technique, and we write about the good to do the GBT and the advantage of GBT. And now I am a pediatric dentistry resident, but I my focus of my career of my life is to do GBT for every kind of every part of dentistry, because for me is the basis of all dentistry, GBT, and the preventive dentistry is the basis.
And the interesting part is like today you are a PhD candidate, you are a researcher, but everything started with your grandfather, right? Because
Yes.
you come from a long line of dentist family, and your grandfather built his practice in the 50s, if I'm not
In the
mistaken.
50s, yes,
Yeah.
after the Second World War.
So how
Yeah.
was it? How we start the story in dentistry from the Natoli family?
Yes, my grandfather was Valentino.
Also Valentino.
Also Valentino. Yes, I have the same name of my grandfather, and he was born in 1924 in Italy, and he graduated in medicine, but he have two specialized in microbiology and in dentistry. In dentistry at the University of Pisa, because in southern Italy there's no university that you can study dentist. And he was built our clinic in 1950, and he in 1980 by the grandfather of the current prophylaxis master, the first prophylaxis master.
Yeah, the first airflow was landing in Italy in the office of your grandfather. So
Yes.
and this started the story of prophylaxis and how prevention is important, right? Because you were telling me a little bit. Today you have your father and your brother working also in the same practice as
Yes.
you. So how was this philosophy starting with your grandfather that acquired the first airflow ever to the family business that it is today with your father and brother, like I said, where you have the Airflow Prophylaxis Master, the new device. How was it from that period that this is we're talking about 82 for now that we are talking 2024?
Yes. Well, in that period, in 1980, 1982, 83, the dentistry was so different than today.
Yeah, for sure.
Was extractive dentistry, because the people went to dental clinic only to
When there
extract
was a
teeth.
problem, yeah.
Yes, when there was a problem. There isn't a dental clinic based on preventive dentistry. But my grandfather, Valentino, have an idea to change an idea of the dental life, because he he buy the first prophylaxis master, the first PA to take care to do the preventive dentistry, because he was a microbiologist, and he studied a lot of bacteria in the hospital, and he see how the bacteria can can influence the life of the people with the systemic disease. And the oral hygiene in that period was so different because don't exist a peasant after 82 after he buy the peasant, and the totality, the 19% of dentists use a scaling,
Hand
a manual
scaling,
as a scaling. And I think if I buy this peasant, I do a lot of prevention, a lot of hygiene, and this is good for the people because they don't have a problem of calculus, of halitosis. They understand the importance of the prevention. He bought also the biofilm disclosure.
Yeah, I had also the disclosure at the time. Okay, cool.
The disclosure. He used the Airflow with bicarbonate. Now we use the erythritol, but at that time
It didn't exist.
didn't exist the bicarbonate, and we eradicate dental plaque, eradicate calculus with the use of the Airflow and the piezo.
That's a funny story because and then how come that your father continued the work of your grandfather?
But because I think that dentistry is in our heart,
In your heart, in your blood, everywhere.
everywhere, and because we have a lot of patients, will love my grandfather, my father. In Fasano, in my town, in that period, was only 2 or 3 dentists for a lot of population. Entonces,
Yeah.
and for this, there's for this reason, a lot of work in.
Yeah, I can imagine because you're. And one of the things that I love in this kind of practice, because I had the opportunity to meet some family practice that is passed generation to generation, is that you will inherit patients from your grandfather, patients from your father, and you want to prolong maybe in the future for your kids. I don't know. Like you are still a
I
young
hope,
man, so
if they want,
if
one
they
day.
want, yeah, for sure. But that's the beauty is that you could see the results of the prevention apply already from your grandfather in some way of your patients. I imagine. I don't know. Like you tell me.
Yes, I think that the prevention dentistry is the basis of whole dentistry. My grandfather teach to me, to my father, to my brother, that if we control the bacteria in an oral mouth, we control air bacteria, or we control a systemic disease like hypertension, like diabetes mellitus, or like a cancer. There are many studies that speak about the importance of oral health, the importance of a control of bacteria in oral mouth to control the systemic disease. And my grandfather teach me this, that we can control we control many system problems thanks to prevention, thanks to dental prevention, thanks to GBT.
Yes.
Is the key, because if we control plaque, if we control calculus, dental plaque or calculus, we can't have adhesion in conservative dentistry. We can't have a good whitening teeth treatment. or we can have adhesion in orthodontic patients or patient with bracket or if we control a periodontal status, we don't have a good treatment, a good orthodontic treatment.
Yeah. I imagine also that there was a long, long time in terms of education to the patient, because you said in the beginning that people were coming because they had a problem to extract some teeth, and then your grandfather implementing prevention.
Yes.
And then you come and you change the prevention way that he was doing with the sodium bicarbonate for GBT, where you are using the retitrol, where you are using the Airflow Prophylaxis Master, where you are preaching the minimal invasiveness to, where you are preaching even further the prevention. How was it? Was it easy to implement in your patients?
Was easy because they know the GBT or the prevention thanks to my grandfather.
Yeah.
They know the biofilm disclosure. They know the Airflow. They know the bicarbonate, the limon bicarbonate,
Yeah.
and the piezo. Every patient know the use of Airflow for the contamination or for to eradicate the calculus and the piezo to eradicate the calculus more higher. Uh, every patient in my clinic know that we use from 40 years
The technology.
that technology. And when arrived a new patient, was surprised to the technology we used, because a lot of patients don't know the prophylaxis master, the comfort of prophylaxis master, the water that was hot and not cold, the piezo, the regulation of intensity and the power of piezo, or the regulation of airflow, the heavy tritor, and how we can do and pass to the power of 3 of the power of 4, and there are something that do the difference, and the patient know the difference, and he appreciate this difference between the other colleague.
Yeah.
Because in my dental clinic we do this methodology, we do the GBT, the user airflow, your piezo, um, since a long time, and they know this method, and they ask me only the passage to the bicarbonate to erythritol, because they don't
What
know
is the difference?
what is the
Yeah,
difference.
the taste. Also, that they don't feel the retitrol. Yeah.
Yes.
But if you tell me that the education was easy, don't tell me that it's easy to work with the family, is it? I couldn't do it with my family, and I love my family. But working in the same space as my brother, my father, like, how is it the daily business?
Is it's not simple to because I have a mind, my brother have a mind, my father have a mind, and we can we speak, we can to compromise, because the life
Yeah.
is a compromise of and it's not easy.
It's not like I see my brother. My brother is like 3 years younger than me, and we fight about football. So I imagine if we need to work together to fight about treatment plans and how to approach the patients. How is your brother is an orthodontist,
Yes.
right?
Yeah.
And your father is a GP, is a general practitioner.
General practitioner, yes.
So and you are doing the pediatrician and the perio too.
Yes.
Yeah. So you complement each other.
Yes. And the power of us is that we do a different part of dentist, because I do the GBT, but I do the pediatric dentistry. My brother do orthodontic. My father do prosthesis, and we do a different part of dentist to each other.
Yeah, yeah.
But
But
it's not easy.
yeah, and you always bring work to the dinner, no? The
Yeah.
family dinners for sure. You're gonna talk about dentistry.
Yes.
And your mother, how is it with your mother?
My mother is a teacher, is the Italian teacher, and he hear this conversation, but with he was she was a little boring to hear about the teeth, about treatment, about to do this, but I but oh, what we speak about this treatment or because for example my brother told to my father because you have do this treatment to this patient. I think that was it was important to do another treatment.
Yeah, like all families, we are both from the south of Europe. We know that we always gonna have different opinions with the family, so it's normal. But this is also healthy, right?
Yes.
One thing is like everyone agree that prevention is the good thing.
Yes,
Okay.
this is the basis. The basis come from my grandfather and to my brother, to me. This is the basis. The basis for all. And the prevention dentistry is the basis for all the dentists in my clinic.
In your clinic.
See.
Valentino, it was really a pleasure to have you here. It was that story. I shared that story with everyone that I know. The story of your grandfather that you implemented himself in the 50s as a practice owner, that he got the first airflow, and it's been more than 40 years that you are working with EMS.
Yeah.
And how proud can he be that the grandson continue his work in terms of prevention, and the grandson not only continue his work, but he also became an SCA trainer and is teaching others to adopt the same style of life. So
Thank you.
once again, thank you so much, and I hope to see you soon. And maybe in a couple, well, I'm not gonna say a couple of years, but in 30 years, maybe having the next generation of Natoli in your practice. That
Yes.
will be fun.
Yes, the next generation of GBT GBT dental practitioner.
Dental practice owners, yeah, with GBT. So thank you once again.
Thank you.
For everyone that hear us, thank you so much, and do not forget subscribe our podcast in any platform that you are used to hear to our podcast. Can be Spotify, Apple Podcasts, or even at YouTube. So stay tuned and see you on the next episode.